Hello, and thank you for joining me looking at phobias today in the Psychology for All free sessions, usually live on Facebook, but this time I've decided to record it and upload it for you. So just have a look on the front page there, on the slide, sorry. What is the phobia that is being named? Pause may give yourself a few minutes to have a look at, can you figure out the top 10 phobias? So the top 10 phobias, we've got spiders, snakes, heights, entrapment, dogs, thunder and lightning, enclosed spaces, germs, flying and holes. So well done if you managed to get those correct. There are lots of recognized phobias, um, some of which are less common, like belly buttons, clowns, lots of different ones. Now, it's really important to recognize that phobias are a real um, medical diagnosed condition. And to other people, it might seem unusual to be afraid or to have anxiety around those stimulus objects or situations. But for the person who is suffering with them, they are real, and it's important that we are kind and respectful if we know of or come across anybody who struggles with a phobia, because they can be very life limiting and extremely distressful for the sufferer. So, what is the difference between a fear and a phobia? And again, you can pause at this moment now to have a think of that question. Now, different signs of fear come from physiological things that we can feel in our body. So, sweating, shortness of breath, feeling out of control, dizziness, feeling of overwhelm, nausea, chills, rapid heart rate. Now, we all may have experienced some of those things, or even all of them, when we come across something that we are fearful of. Now, the reason why these things happen is because our body is preparing for fight, flight, or freeze. So, this is a biological mechanism, something that happens within the body to prepare yourself in a situation that you perceive, you feel is dangerous. So your body is preparing the energy for the muscles to fight that dangerous situation, to run in the opposite direction, to get away from that dangerous situation. And something that later was added to the fight and flight response was freeze, because sometimes in these dangerous situations, we don't know how to act, or we need more time to think about how to act in this dangerous situation. Now, when it comes to a phobia, this is when that fear is considered unreasonable or excessive, meaning very heightened, extreme fear. Unreasonable means that maybe it's not in line with reality. That fear is irrational. So often there are thoughts that come alongside this feared emotion that maybe don't seem to make sense to other people. Often people with a phobia will do extreme things to avoid coming into contact with that stimulus object or that situation. So, for example, if somebody has a fear of flying, they would never ever put themselves in a situation where they would fly in a plane. If somebody had a phobia of spiders, they would do everything they can to avoid that situation. Like I said before, it can be life limiting. This meaning that that avoidance behavior can really impact on daily routines and life. And the DSM, which is a diagnostic statistical manual which clinicians use to diagnose phobias, suggests that a phobia or this intense fear needs to occur for at least 6 months in order for it to be a diagnosable condition of a phobia. So, what causes a person to develop a phobia? So, again, pause now to have a think of this question. Psychologists have pondered over this question, and there's lots of different explanations. But one of them is this idea that having an extreme intense fear of something keeps us safe. Now, this is illustrated in Inside Out with the fear character. Fear was created in Riley's mind when she was very young, and his job is to keep her safe by monitoring hazards around her. So, there's an example in the film, such as a power cord that she could trip over. And this idea can be developed and looked at with phobias. Now, I'm not sure if you recognize that man there. This is Charles Darwin, and Charles Darwin developed or suggested the idea of evolution. This idea that we have biologically evolved over time, that species evolve over time to have the traits and the qualities that aid survival. And any of those traits and qualities that are not going to help survival of a species eventually die out with that particular species. So if we were linking this to a phobia, Seligman prepared or suggested the preparedness theory and said that humans are biologically prepared to learn to fear objects and situations that threaten the survival of the species throughout its evolutionary history. So, this idea that it's innate within us to fear objects or situations that might threaten the survival of species. So, one thing in psychology which is often debated is whether behavior is a result of nature or nurture. Nature being biological, innate factors, or nurture being the environment, learning experiences, people around us. Now, the Seligman theory is on the end of the nature side of the argument, suggesting that we're biologically prepared for this feared behavior or response. But the problem with this is it doesn't explain all phobias. What about a phobia of something that doesn't cause any immediate threat or danger to life? For example, a fear of belly buttons. So, an alternative explanation comes from behavioural psychologists. Now, this is a psychologist called Watson, who was one of the first to suggest that behaviour is a consequence of learning and that it's nurture, not nature. Watson believed we are all born blank slates, and it is situations and people and our environment that shape who we are and influence our behavior. So, linking that to phobias, there's something called classical conditioning, which was developed by this man called Ivan Pavlov. He actually wasn't investigating phobias and he wasn't investigating what he later found. He was merely interested in how much salivation a dog would produce when they saw food. But what he noticed while he was doing his investigation, that the dogs salivated when the food was present, but they also began to, over time, salivate when Ivan Pavlov entered the room, even when the food wasn't present. And what he began to consider was, did the dog associate Pavlov with the food? Because the dog learnt that when Pavlov entered the room, food was also going to be produced. So Ivan Pavlov wanted to investigate this idea, and he decided to pair the food with a ringing bell. So every time the dog heard the bell, he would produce the food. Over time, he realized that the dog would salivate in the presence of the bell, even when food was no longer present. So, this supported his original hypotheses that the dog learnt to associate something with the food. So the salivating to the sound of the bell was a learnt response, and Pavlov said this was learning through association. Classical conditioning is learning through association. So the dog learnt to salivate because he learnt to associate the bell with the food. This was tested in terms of a phobia. So the little Albert study in the 1930s or 1940s by Watson and Rayner, they conditioned this infant to be scared of white rats, white mice, and anything white and furry, really. What he did, and what they did, was they showed little Albert a variety of white furry objects like um, the rabbit, a dog, a mouse, etc. And what they recognized was that little Albert was not afraid of these animals. He then paired the animal with a loud bang, so struck two metal rods together. And what they found was that over time, little Albert started to cry just at the sight of the animals, even when the loud bang wasn't present. So little Albert learned to associate the animals with the loud bang. So why does a feared response continue? When a person avoids the feared stimulus, there is no anxiety or fear. This removal of the unpleasant consequence of fear reinforces the avoidance behaviour. What that means is, in order to stop feeling the fear and the anxiety associated or that comes when the person is in the presence of the phobia, then the person will avoid that situation or object. If they do, they will not feel fear or unpleasant feelings. So this kind of rewards that behavior, and they will continue to avoid the stimulus in order to avoid the fear. And this is something known as operant conditioning. This doesn't explain all phobias. What about a person who has not had an unpleasant experience with a phobic stimulus? And it doesn't explain the irrational beliefs that come along with phobias. Somebody might believe that a house spider in the UK is very harmful. There's not a lot of evidence to suggest that, so that might be considered irrational. So, what about these phobias? So, one thing we've got to recognize in psychology is that there's lots of explanations. Some will be relevant and appropriate to some people, and some won't. There's always limitations and strengths to theories, and that's why psychology is such a good subject because you get to debate these things. How are phobias treated? So phobias are treated based on the explanations. So we're going to first look at that explanation from the behavioural psychologists, looking at this idea that behaviour is a learnt process. So there's something called systematic desensitisation, which is an exposure therapy, where it exposes the person to the phobic stimulus. And it works on this idea of counter conditioning. Conditioning meaning learnt, counter meaning kind of like undoing. So if we can undo or relearn that learnt response. So in systematic desensitization, the first step is for the patient to create an anxiety hierarchy. This is where they will rate different situations with the phobic stimulus or situation from the least anxiety provoking situation to the most anxiety provoking situation. Then they will practice some relaxation techniques. One example is a 7-11 technique. It's a breathing technique that relaxes the nervous system. So if you breathe in for less time than you breathe out, then it relaxes the nervous system. The third stage is to combine steps 1 and 2 and work through the hierarchy practicing the relaxation techniques. The patient will not be able to move up the hierarchy until they are fully relaxed in the previous stage. The reason for this is because of something called reciprocal inhibition. It has been shown and demonstrated that the body cannot feel fear and calm at the same time. It's biologically impossible. So if a person can learn to feel relaxed and calm in the presence of the phobic stimulus, then they can eradicate the fear. Now, this treatment doesn't always work for many, many reasons. And alternative treatments have been proven to be successful for some people. Those include drug treatments, selective serotonin reuptake inhibitors, um, look at changing the amount of serotonin available in the synapses within the brain. This is meant to relax and to work on and reduce the anxiety that's associated with the phobic stimulus. And CBT, which is cognitive behavioral therapy, which aims to change or help change the irrational beliefs associated with the phobic stimulus. So, with CBT, it's a cognitive change and a behavioral change. Cognitive meaning the thoughts are challenged. So, a therapist would guide the patient through some questions and some tasks to help them to see that maybe some of their thoughts are not in line with reality. And behavioral changes try to change some of those avoidance behaviors um, to recognize that maybe it's no longer serving them to have such extreme behaviors associated with these cognitive beliefs. One thing with CBT, it's this idea that cognitions, our thoughts, behaviors, and emotions are all linked. So some of the key ideas we've explored there very briefly. We've done quite a lot there within that very brief session. If there's anything you want to know further, please let me know. Thank you for joining me today. Just to finish there, one thing that I will say is I'm not a trained psychologist. I'm a psychology teacher. So these are psychological concepts that have been developed by psychological scientists or psychologists, and these are the things that are on some of the GCSE and A level specifications. Um, so, yes, I am not a trained psychologist. These are just things from a psychology textbook.